because I have a tendency to get started talking and then forget to hit record. It's now 5 o'clock. We'll give it to 30 seconds after and we'll go ahead and get started. I'll go ahead and start my share screen. There we go. Didn't mean to do that. All right, we're going to go ahead and get started. Thank you guys for being here. And I'm sure we're going to have, I'm hoping we'll have some folks to be jumping on as they're able to. Thank you for joining us today. As you may have read in the flyer or the email that you got, the Department of Housing and Urban Development has made an announcement of some special funding that's available. We're going to talk about today what's available, the amount that's available, what are the eligible uses, and look at how we can meet needs in our community of those who are experiencing homelessness, specifically unsheltered homelessness in our community, and what are some of the next steps. Because I am not an expert in HUD lingo, and because I wanted everyone to hear it directly from the source of the funding, what I did was we're going to link directly to the I'm on now. I know I checked this and it was working just fine. There we go. We're going to link directly to the presentation that the Department of Housing and Urban Development put together regarding the special notice of funding opportunity. And let me just get it back up. I apologize. Apparently I was, as you can tell, I've read through this quite a bit. The special NOFO or notice of funding available. We're just calling it notice. It's just easier that way for addressing unsheltered and rural homelessness. This was announced on June the 22nd. The workshop that you're looking at here, these slides took place on June the 29th. And true to how our lovely Department of Housing and Urban Development normally does it, they did the presentation, said this is coming, these are some reference materials, these are some things you can read, but the application's not quite ready. It's not ready yet. So, excuse me, on not this past, not the 22nd, but on July the 15th at 6:32 in the evening, they finally posted the application. The application was posted with a caveat that the detailed instructions on how to fill out the application would be forthcoming in the next couple of weeks. And I say all that to say, it's only July the 26th, and we're talking about an application that's due, as you will see as we go forth, in October the 20th. But as you go through this and you look at some of this information we're going to share today, that timeline gets smaller and smaller when we look at all of the things that have to take place. Today is the first step in that process, is doing some community discussion, some community planning. We would be remiss to think that you could do a complete community plan between now and then and have project applications and set priorities and do a community application with all of the supporting documentation and all the other things that are necessary in the short period of time. We're going to use some planning that has already been done in our community, some planning that's ongoing, some of our own statistics that we've looked at over the year to put it all together. But we all need to have a discussion. It doesn't need to be those of us who do this every day, those of us who are in it. We need input from, I'm really excited to see you here, Ken, and you, Dr. Hiltz, folks that aren't normally part of our day-to-day discussions about meeting needs of the unsheltered homeless. We want to know the brutal truth of what's working, what's not working, and how do we work together to make it better. I'm not going to go through the housekeeping. Again, these are HUD slides. We have permission to share them globally, but I wanted to make sure you got it directly from them. It was not my interpretation or anything else. It's directly from the funding source. As you can see, there are $267 million that is set aside for unsheltered homelessness. I know there's a rule set aside right there. Our community does not qualify. There's no need to discuss it. It doesn't apply to us. So we're moving right on to making sure that we're discussing those that apply to us, which is the unsheltered homeless set aside. And it goes into details as to who can apply, those who are already registered for the fiscal year 22 program competition. That's our usual annual competition that we conduct in our community to apply for federal funding for homeless service providers. We've already been registered. We've met the criteria. Our community is eligible to apply. Project applications and must be submitted to the continuum of care, of which, of course, you know, Home for Good is the lead. There's a priority listing, and there's all kinds of details that go into how you get to that priority listing. Part of the priority listing and getting to that priority listing, again, begins today. We're going to be setting those priorities for our community, meaning who is the most vulnerable in our community, or who is it that we want to focus on. We as a community can set that. This is not someone telling you how to do it. This is us saying we have the money, and if we qualify for the funding, this is how we want to use it in our community. We can use it for some plating. It's no more than 3% of the maximum award for a community. So for our community, that's only about $51,000, which is really sort of insignificant, but it is available to help some of the planning. But that's over a 3-year period. So this is a 3-year grant. And I'll go into the specifics, what's available for our community. It's right at $1.7 million. And it's spread out over a 3-year period, making it very clear that you don't need to spend the first third the first year, the second third the third year, and the third third the third year. But it does have to be expended in that 3-year period. I said the deadline is October the 20th, 2022. Talking about setting the priorities, again, that's what we're going to be doing. But the priorities for the Department of Housing and Urban Development are the unsheltered homeless. Again, rule doesn't apply to us. Tribal lands does not apply to us. But making sure we're getting a broad opinion, a broad swath of the population in our community to give us an unbiased look at what's happening, what's not happening. Tomorrow, when we do our presentation or our community discussion, we will have this virtual option as well, but we'll actually be on site at Safe House Ministries, talking with some of the folks with lived experience, some of those who are currently homeless, some of those who have or are formerly homeless, some of those who've had severe conditions or severe vulnerabilities to accessing housing, those with, as they put it here, severe service needs, those with severe persistent mental illness, those with substance abuse, drug abuse, those who maybe have HIV or AIDS, and those who are formerly incarcerated. So looking at those priorities and making sure we're including a wider variety of individuals in the community. Okay, again, the set-asides, as I said, are the unsheltered and the sheltered. They sort of repeated themselves here. And our community has, I'm sorry?
My screen is not changing. Are other people's screens changing? My screen is set on the first screen. I'm not seeing anything but the first screen.
Anybody else weigh in, please?
Yes, same screen.
You're not seeing this unsheltered homelessness set aside?
No, we're not seeing any of things.
No.
Okay, I'll try this again. Let me try one more time.
I'm sorry for not mentioning earlier. I thought it was intentionally set at that same slide.
Well, she looked like she was looking at screen. Yeah, now we got it. Yes, there it is.
Okay, cool.
Thank you.
So thank you for speaking up. The unsheltered set aside and the rural set aside. Again, it's FY22 PPRN and all the other acronyms and initials that our federal government comes up with. Again, I'll tell you the exact number. It's right at $1.7 million that's been allocated that our community could apply for. It has to serve anyone in our geographic region, which of course for our area is Muskogee and Russell County. and it's based on the score, and we'll go into a little bit more as to what they're talking about in scoring, but it's based on 100 points, and any community who doesn't baseline get 50 won't even be looked at. But any of those who are above 50 will then be ranked according to their score, and made available for funding. It's a lot more complicated than that, but that's the basics. Okay, here we go. Well, you would think I read this because I went ahead of myself. 100-point score, and you must score at least 50 to be considered for funding under the competition. Okay. Again, these are just some of the things. I'm not going to sit here and read all this because I'm going to send every one of y'all. That's why, again, why I need your name, your organization, and your contact information in the chat box. We will send everybody. We will be sending it out to everyone we invited as well, but we want to make a special effort to reach those who've been here so that we can follow up with some questions specifically on ranking and prioritization. But we'll send you all of these slides, but it's looking at this and talks about it's the sort of the subpopulations or the subcategories in the application that you're scored on. So making sure that we are doing what we need to do to score the maximum in each of those categories, but honestly doing it for real and not doing it just to check a box once a year, or in this case once every 3 years, and say, yep, did that, and then move on. This needs, and those of you who know me, I get really excited, and sometimes I get a little fast and loud, because this is a start of really doing some system planning and really being able to hash out some good ideas, and honestly tell each other that you know, we've done that, we keep doing that. That's not working. It's not getting us where we need to be. Let's make a U-turn. Like it says, take a left. Let's try something new. So this is the beginning of that process. We're not doing this conversation tonight at 5:12 when all of us would rather be on our way to the house just to check a box. So talking about meeting the needs of those or serving those with severe service needs, that's going to be a little bit different than we've ever done before in our application processes. It's up to a 15-page narrative of how we've done it, how we do it, how we propose to do it, talking about partnerships with mental health, partnerships with Department of Public Health, partnerships with federally qualified healthcare systems, partnerships with treatment facilities, partnerships with like Access to Independence, agencies who serve those with severe disabilities. So all talking about partnerships, and how we work together and how we're going to meet the needs of all of our clients, especially those with severe service needs, because they are literally the ones that are who are most vulnerable in the unsheltered population. I'm sorry. Okay. Again, this goes into the description of that. I'm sorry, I'm a little ahead of myself here, but how the very specific instructions on how to answer those questions in the application for those with severe service needs. This talks about a rural set aside, so we're not going to even worry about that. Again, talking about those with severe service needs, how we do some of our things, whether it be access to low barrier shelter housing, how do we make sure that we do our outreach and those kinds of things. It does say necessary for rural, but it does apply if we're applying for outreach as well for our unsheltered set aside, and goes into more information about how we need to focus on and how some of the answers or some of the questions we may need to answer in our narrative for those with severe service needs. Unsheltered homeless bonus points, we won't get any. I'm just here to tell you our unsheltered numbers are below 999, and this is trying to focus, and this was an inducement from the Department of Housing and Urban Development for larger communities to do an application, because at this time of the year we're usually in, and we will be soon in our normal federal application season. So the thought of doing 2 applications at the same time is a little daunting. And if you're a larger community, it's even more so, obviously, because there's more to do. But this bonus was put in there to try and entice some of the larger communities. The Dallases, the San Franciscos, the Los Angeleses, the New Yorks, the Buffaloes, to the Chicagos to apply for this. Again, it'll be the set aside scoring allocations or awards will be based on scores. Those highest ranking will obviously will get first consideration. And each of the projects, though the community may have scored really well, each of the projects have to pass a threshold as well. And all of those links to all that information will be in what we send you. Rural set aside, we're going to go back over that. Talking about geographic diversity, meaning that they're not going to fund everybody in the Northeast and nobody in the Southeast, or vice versa. But there's a maximum of 10 COCs that can be awarded in any state. Well, guess what? Georgia only has 5 COCs, and we don't have to worry about that. Now, not saying we're going to get awarded, but we don't have to worry about competing against other Georgia COCs in that there's too many of them for all of them to be funded. If we all do well, everyone in Georgia technically, could get funded. Okay, talking about what's eligible, and I promise you, I got about 6 more minutes of talking, and then we're going to have an open discussion. The projects that are eligible for funding under this, and again, this is their slides, that way I don't mess it up. Permanent housing, and it says here permanent supportive housing. For those of you who are not in the homeless services business, that's housing, that's rental assistance, utility assistance maybe, with a case manager. So somebody's standing there and holding your hand on a very intensive basis, meaning that you need someone checking to make sure that you're taking your medicine, you're going to your doctor's appointment, you're keeping up with all of your therapies or this, that, and the other, in order for you to be able to maintain your housing and maintain your physical and or mental health, and maybe sobriety, if that's one of your goals. We can't require it, but if that's one of your goals. And that intensive case management is probably 3 times a week. So that's permanent supportive housing. Very labor intensive, thus very costly. Okay. Permanent housing, rapid rehousing is is rental assistance, utility assistance, payment kind of thing, with case management light, meaning someone's going to check on you a couple times a month for the first couple months, then once a month for a few months after that. And as you are, these are folks who are pretty independent, just needed some financial assistance, maybe a little bit of budgeting training, maybe some job training assistance, maybe some help with transportation for a little while, to get back on their feet and then be financially sound and economically upwardly mobile. The joint TH and THRRH, again, they love to use initials. It's transitional housing to permanent housing, which is rapid rehousing. Transitional housing for up to a year for those who need to live in a congregate-like or a monitored setting. Most of the time, this is mental health and or substance abuse, so that they can undergo treatment, detox, medication management, mood and behavior stabilization, until they are ready to move into that rapid rehousing phase where they can live independently with some light supervision. Also, coordinated entry, for those of you, again, who may not do this every day, coordinated entry is how folks access homeless service providers, going through a standardized, equitable, and fair assessment for everyone who enters our system, whether it be online, on the phone, or via a form that they have faxed or emailed over. So coordinated entry, having extra people to be able to manage what we would assume with more funding would be extra folks coming into the system more quickly than normal. Street outreach, very, very excited to see street outreach on here. Street outreach has never been funded in a federal competition that anybody I've ever talked to has ever been aware of. Street outreach has normally been funded only in our CARES funding, which we have, which will expire next September, and was funded in very, very small ways in mental health, for those experiencing mental health issues and mental health providers. So having a street outreach folks that we can, that can go, and those that can cross the river, because we've never had it, again, federally funded. So any outreach we did had to stop at the Chattahoochee River. So really, really excited about that. The standalone SSO, meaning supportive services only. I will send you the recording of the meeting again, that goes along with these slides. They're talking about community case management. That being another thing that has not been funded in the federal application in more than 10 years. And guess what? We're seeing that case management has been, or long-term case management has been the missing piece, and folks sustaining their housing. So having the ability to do that at least for 3 years, and with the caveat that this funding may be able to be rolled into our normal annual funding as it expires, which is what we're hoping for. So HMIS, which is our homeless management information systems. Each community is required to manage a database system, HMIS, to collect certain data points and submit reports to federal, state, and local authorities. We manage that here at Home for Good, but we would need to expand it if we brought new programs on board. And COC planning, as I mentioned before, and UFA costs. No one in the last year's competition applied for UFA, so that they have to put it in there because it technically is available as Congress passed the law, but no one applied for that. So if they didn't apply for it last year, no one would qualify for it this year. Okay, so in general, all those things I talked about are about, yes. Okay, I promise, I 3 more minutes and I'm gonna hush. All those things I talked about are available, and these are the things that are not available for funding. Acquisition, new construction, except in the rural set aside. Okay, COC is under unsheltered only, and the others are eligible activities for rural set aside loan. So we're going to go along. Okay, talking about some project requirements. Everyone has to have a housing first approach, meaning we can't put a bunch of stipulations on the clients to participate in our programs. We need to meet the clients where they are and then design the programs to meet the needs of the clients. Consistent with meeting those with severe service needs, project applications need to make sure that they meet those requirements. And this is the page, the link here works. And as I go back and stop sharing for a minute, I'm going to ask you guys if you have any questions. Come on, this group cannot be this quiet.
Pat, you said something about the my letters are gone somewhere.
UFA?
Yes.
It's
What
Unified Funding Unified Funding Agency, and it's normally a COC who applies for all of the money in the community and then doles it out to subgrantees.
Okay, and how you had stated that the outreach program pretty much is going across the river, right?
It can be on both sides because this is federal funding. Outreach is normally state funded only. So if you're, I could see the person across the bridge, but I couldn't get to them because my outreach had to stop here because that's who funded me, or vice versa. So now if we applied for it and got it, the outreach team could go to either side of the river. Yes.
And when you were speaking about the partnership, at this point, would it be beneficial for us to all sit down at the round table and be like, hey, this is what we offer, this is what we offer. So that way we kind of like can go in as one up under this grant, or does that?
That's why we do the project applications and they flow up into the community, which is called the consolidated application. That's exactly what happens. Yes, ma'am.
So with this application, you said it's due in October. When would we like collaborate just to see what everybody offers?
Okay, we're about to get to that in just a few minutes.
Okay, sorry.
No, that's fine.
It sounds exciting though.
It's a very exciting, very, very exciting time. Okay, let me see if I can get back to it.
Thank you.
Uh-huh. So any other questions?
Ooh,
Yes.
you said one thing, this is Ken Henson.
Hey,
You
Ken.
said that, I made a note, no one has applied ever for something. It was back about 2 slides.
No one applied last year for the UFA.
And what is that?
The Unified Funding Agency, that's again where the continuum of care, which would be us, applied for all of the funds in the community and then doled it out.
Okay.
Yeah.
Okay. All right.
So would that be like considered, you guys are like the mother agency? I think that I'm using the right terms.
But basically, but then also that would require a lot of fiduciary responsibility in the community and oversight, and with them only having $51,000 in planning, that it wouldn't be enough to be able to have the person to administer that. And that would be part of the planning. So, okay, let's keep. Okay, oops, I had to hit share. So, where did it go? It's going to take me right back to the beginning. Okay, here we go. Here we go. I'm sorry. This. And here we go. Okay. So, as I said, went through all that. All of these are the links and they all work. And again, I will be sending them to you guys. One more plug for please name, organization and contact information in the chat box. You can get this a lot quicker. We'll send it out tomorrow after we do our 1 o'clock. We'll send it out to participants and everywhere in both of our community discussions, along with a questionnaire talking about ranking of priorities. So you'll get that. But one of the things I mentioned earlier was, to expect a community to do an entire planning process, set priorities, and do applications and all that in a time period of less than about 3 months is unrealistic. And honestly, we plan all the time. We're having conversations with cities, on this side of the river and that side of the river, Muskogee and Russell County, talking with service providers. We're talking with landlords. We're talking with, all kinds of folks, community stakeholders all the time about what are our needs and whatever. But one of the places that we start, because anything that we fund or we apply for through the Department of Housing and Urban Development must be in line with your community's consolidated plan. Russell County does not have a consolidated plan. They defer to the state of Alabama's. So then we look at the consolidated plan of Muskogee County or the city of Columbus. I just have taken screenshots here. Now the link to the actual consolidated plan in the slides actually it's not going here. I will, there we go. It should take us right to the consolidated plan. I just want to show you guys that these links do work. Here's the entire, obviously you didn't want me to put 185 pages in there. So I have the link here and I cut from there the things that apply to us. So of the top 3 housing and community development needs, they talked about transitional to permanent supportive housing. If you remember, that was an eligible expense. Supportive services or case management. Again, that was an eligible expense. These are community participants of 94 community participants who said this when this plan was in the development stage this time last year, actually. So looking at this, and this is stuff that's already been done. This is the next page. So we're at page 14 and 15 of the city consolidated plan. And homelessness prevention was one. Now that is not an eligible cost in this particular notice. Now there's another notice that's coming out from the city that prevention is an eligible cost. But looking at this plan that was already put together and folks participated on, I think was a good start in looking at what we need. Again, and I jumped ahead of myself in my chit chat. Again, these were eligible activities slide that I took from earlier in the presentation. So the things that we're talking about, many of them are eligible activities. So we're going to talk about needs in our community. And when we're talking about them, if you're going to talk about them, please do. Again, we're recording this and we'll send this out to everybody, but if you want to put it in the chat box, that's great too. Once we gather all of this information, we're going to put together and we're going to send it out to everybody here. We'll send it out to everybody in our continuum of care as well, but we're going to send out especially to those who participated to talk about ranking them, lowest need to highest need, a 1 in 5. So you know what, I just realized I'm going to stop sharing for just a minute, and I'm actually going to pull up because I don't see where I had it in here. But you know what, it was in the invite, the actual amount that we had available for our community. I want to be able to say that without a doubt. So I'm going to pull up, we're going to go to our link in our, so I can show you that they actually work, and we'll go there together. So here we go. And it's going to be here. This is Appendix A, and we'll be able to look at together exactly what's available for our community. If I can hit share screen. Okay, and you should be looking at a sheet that says GA 505 right about here. Everybody see that? I hope somebody nod their head. It says Muskogee, Columbus, Muskogee COC. And this first column is the unsheltered set aside. The second column is the rural set aside. If you can see our community, there's $1.746 million that we are eligible for in our community for those eligible activities. Again, I will send this, and again, this link is in the PowerPoint presentation that we're going to be sending out to everybody. So I want to make sure that each of you saw that's not a small number. Now it's over a 3-year period, but that's a huge chunk to make a huge difference in making sure that we're able to serve the most vulnerable, serve those who we know. Unfortunately, in the next couple of months to a year, we're going to be probably in a stronger financial bind than we are now, and so making sure that we've done our due diligence to make sure we have all the resources possible to meet our community's needs. So
And I think the thing we need to understand is that's in addition to the money we're already receiving.
absolutely, yes, sir.
And
You
not
are
only
absolutely
that,
right.
it will also maybe continue once the 3 years are up. That could
That
continue.
is correct, sir.
So that could be a lot bigger number over time.
Correct. So again, we're having another discussion tomorrow on about this, and we're gonna start talking, but I just wanted to tell you what's coming down the road. We will have a technical assistance workshop on August the 16th, which all those applying for assistance or doing a project application will be required to attend. We will do a public announcement of that on this Thursday or Friday morning. We will send it out to everybody. We will post it on our website. We will post it on our social media. We will send it out to both of the county governments, Muskogee, Columbus Consolidated Government, and the Russell County Commission. to let them know of the workshop and the eligible activities. At the workshop, the application process will be explained, the timeline for which you need to submit things, the forms, and any special submission requirements. For instance, we have to have a form that's called consistency with the consolidated plan. That's why we're looking at the city's consolidated plan that must be signed off by local governmental officials. We'll have a process and a timeline for submitting those. The city requires that the continuum of care, Home for Good, gather them, document that the project is a participating provider in the continuum of care before submitting it to the city manager for signature. So we'll go over all of that on August the 16th. Project applications will be due back in either on the 18th or the 19th of September, because it's required that there be at least 30 days between the project submission and the community submission, which is October the 20th, because it has to be scored. The project has to be notified of their score, where they ranked in comparison to everybody else, and if they will be included in the consolidated or the community application, and if not, time to appeal it. So all of that has to happen by the same time we're writing the community application and bringing all these different project applications together and having a cohesive thought process, and then hit submit on October the 20th. So those are the next steps. So again, while we're going and we're about to have some hopefully some robust discussion on crystal ball, if you had pixie dust or you could win the lottery and do anything you wanted to, what would you do? If you have not already, please put your name, organization, and contact information in the chat box. That way we can send you the information specifically to you, and we can have a record of attendance of today's meeting. So somebody get the conversation started. Susan, I saw that you had commented that it was exciting news about the outreach. You know what a struggle it's been to have funding for outreach and how intensive it is. So speak on that, or Ron, if you want to jump in there, please. Let's have some discussion of, if you could do anything, what would you do? Miss Sarah, I'd be interested to hear what you had to say as well.
Well, since nobody else wants to say anything, I'll say something. I've got one question. You said there was no new construction allowed under the.
Not under this one, no, sir, there's not.
So it's
Only on
really-
the rural set aside, but Ken, that is true. However, the city has a I'm not sure if you were on the call last week or not, I don't remember. The city announced they have some ARP funds
Yeah,
that are available, and there is new construction and acquisition allowable with that. They're presenting to city council on the 9th of August for or is it the 6th? The 6th, I'm sorry, the 6th of August. The 6th of August are going to the community reinvestment is going to city council to make a recommendation that we accept the art funds and that we allot them this way with priorities. It's still in the comment stage, so I would encourage you to contact Rob Scott and put a bug in his ear if you want.
so the follow-up is, how do you come up with a new idea if you can't have new construction?
A new idea is,
Or-
go ahead.
Yeah, how do you do anything new if you can't use the funds for a new building or new structure or something?
It's taking the resource, part of it is programs to realign and change the way they've been doing things. I'm going to go out on a limb of trying to say, there are some of us on here that have seen major changes in the landscape of who's serving who and how they're serving them over the years. So that's part of what this is trying to spur, because the idea, for instance, Bill, one of the discussions that I was involved in last week, I point blank told them what they didn't want to hear. We didn't need any brick and mortar emergency shelters. What we need to do was and this goes to your point too, Ken, we need more affordable housing so that folks can quickly move into permanent housing and we don't do that step in between. But I'm gonna hush. Ron, you had something to
I'll
say?
give you an idea, Ken, of an idea. I would love to see one or two teams that daily, when they come to work, they're permanent out on the street, going from place to place,
Yeah.
working with people, and we have enough funding to pay for them to do that. And that they would have a structure, a place where we could make the transitional housing process occur. Because every day somebody new shows up out there, and we get a call, somebody calls and see this person, they call. And we don't have enough people out on the street in terms of street. There are communities that have that have street teams that are out there going every day, working with the people and making sure that anybody new that shows up, we don't miss them, and we get them as soon as they show up on the street. That's a possibility.
Yes, and that's you're right, Ron, because Ken, I know you and I have talked a couple of times, and I've noticed something, and I've said, hey, have you noticed it, or this, or vice versa. And our team actually equates to one person. That's Eric.
Right.
And he's only partially funded as an outreach
Right.
person. He has to do double duty as emergency just to make it economical, and affordable, and so we can pay him. So yes, outreach is one of those. And then Cheryl, I'm looking at you on my screen. I know you've been a big proponent of case management over the years, and how exciting it would be to be able to have a community case management program where we have
Right.
a standard on how folks get services and throughout our community.
Oh, absolutely. And just a lot of times people need that aid in knowing that, I'm not going to have to write this check this month to pay the rent, So that's one of the big things with case management too, is sometimes it's got to be intense. Sometimes it doesn't have to be intense, depending on the person's, mental status and how they're able to handle things. But sometimes, we've got to be able to provide services for everybody, not just for somebody who is able to manage their funds, but for those people that aren't able to manage those funds. So that's one of the things, I'm really thinking about is, how can we use this money to make sure that we're providing that support for people, and outreach too. Outreach is part of support too. I do a lot of that right now, and you have to meet people where they're at. But, also the definition, who are we helping here? Sometimes, we get so wrapped up in, well, they've got to have a job, or they've got to have this, or they got to have that. It's a lot of times we just have to meet people where they're at. So sometimes they're not going to have income. They still need help. So, that's my concern, is we've got a whole community. The problem is sometimes, I've worked in this field for a while, and sometimes there's so many barriers that we make, and things people got to jump over that, it's really better to have somebody who's case managing that and just saying, hey, I took care of this, now we need to get this. Let's sit down and talk about this. Now we've got that together. I did it today, working with trying to get, somebody's rent paid, and, just had to literally take it over myself because there was nobody to case manage the situation. It was a mental health situation. And, there was just nobody there that could jump in and do it. And it just needed to get done. So, but we really do. We need to meet people where they're at. Sometimes they need a lot of help. Sometimes they need a little help, but, just being able to judge that
Right.
For them and meet them there.
And then before we go any further, and then when we're looking at what programs we need, if we had a crystal ball, I would have, a team of 5 outreach people and 5 community case managers and 2 new rapid rehousing programs, just throwing these things out there for food for thought. But also, who are we going to prioritize as the top? So if I had, Pat Frey, single female, homeless, and then I had Cheryl Kolb, single mom of 4 homeless, who's the greater priority? And I'm just using that as an example. So that's part of the follow-up we're going to do out there as well. We have priorities in our community. we have priorities that have been set by our boards and this, that, and the other. Do they still fit? Are they still where we want to put are they valid for today? A lot has changed in the past 2 years, let alone 5 years. And I think we reprioritized 4 years ago. We rearranged our priorities. And every year, be frank, it's like, yeah, we're sticking with them. Yep, okay, we voted on it. Everybody's, yep, okay, aye, and it keeps moving. But getting this broader group, and this does, we have, I'm counting 5, 10, we have 13 folks here. But these are more than half are folks that are not normally in these conversations. So getting that opinion of folks on the outside to say, well, why would you prioritize, and I'm just like, why would you prioritize single females over households with minor children? That doesn't make sense. Or, why would you not prioritize those with, severe physical and or mental disabilities before you would a person without it? So making sure that we're addressing all of these, and again, that goes into those, serving those with severe service needs.
And
How do we align that, and how do we prioritize that? Yes, ma'am.
And it may be better to create a scoring system instead of saying, well, creating a scoring system where you've checked all these boxes and this person's got a score of 15 and this person's got a score of 5.
And we do, right. And that's how we do it now. We have the prioritization comes if the scores are the same.
Yeah.
Okay. So if Pat and Cheryl both have a 15 and I have one bed, or I have one voucher, or I can service one household, who would go first? Yeah. Yes, we do have which is called a vulnerability index. Yes.
Well, and then there's the whole, what pushes her over the edge? So is it the unemployment? She has no income, those kind of things. So
right.
And that's the way, I know it is with GRA, we've got a scoring system, and then there's the 3 things that push you over. It's being under that 50% AMI, there's the unemployment, and then the eviction throws you clean to the top, So you always have those 3 things that are the final.
Right.
push you over the edge kind of things.
Right. Miss Sarah, anything? I don't mean to put you on the spot, but I'm so excited to see you here, about any ideas on how, or things from a healthcare perspective.
You didn't put me on the spot because I'm sitting here thinking what would be needed, along with case management and the community health worker that's assisting that case manager. My brain's going all over the place. I mean, there's medication management, the need that we're seeing, and how do we address that? I mean, it just,
And I would like to, when I will be set, excuse me, let me back up that tape there. Tomorrow, after we do our second community discussion, we'll be sending out the PowerPoint from today, which will have the link to all of the HUD slides, the recording, and the like, and the notice, which is it's about 65 pages. And if you'll just flip through, there are some, it really is a quick read. Excuse me, a great table of contents, so you can go to the area you're looking for. But talking about healthcare and partnerships with homeless service providers and healthcare providers. Ms. Sarah, this is the things you and I talked about earlier this year. This is the same thing that Melanie's with Piedmont, with the mobile unit we were talking about, is how can we better coordinate so that we make sure that our clients' needs are being met along with your patient's needs. And so it's not my patient, your client. It's
exactly
our community members and how we're meeting their needs.
that's true.
I'm excited to have that further discussion. and do some brainstorming and some planning towards that. Anybody else? Comments, concerns, follow-ups? Is there anybody who has not put their name, organization, and contact information in the chat box?
I would want to follow up with Ken to say, we all know that we need housing, affordable housing. We need more affordable housing. Now, we may not be able to build it here, but maybe we can have a program that we educate people who own the housing, all the landlords, and work with them in a more intentional manner. As you know, that's it works.
You're speaking my language there. You're speaking my language.
So, I mean, all of that is part of it. We've done better with it at times than we're probably doing right now. And COVID has shot us in the foot with a lot of this.
Right.
So, this hopefully will help.
Yep.
Well, I'm not sure that affordable housing really needs a push out of this money, but I think there are lots of ways we can provide more affordable housing. We just have to make it a priority.
Well, I hope you will help us do that, brother.
Mr. Ken, sounds like you and Ron and I are going to have lunch here real soon, because I got some ideas. But I think too, and again, I want you to reach out to Rob at Scott, because they do have several millions of dollars available for acquisition and construction for new housing. But also, part of what I think as a community we need to do is we need to hold ourselves and everyone else accountable for making sure that we have safe, affordable housing, and safe being the key word for me, because we all know that that's not always the case. So having a level and quality of life and standards for everyone in our community is paramount.
And I hope Kathy will be part of the conversation tomorrow with NeighborWorks, somebody out of NeighborWorks. I hope will be part of this conversation with us also.
What about transportation?
That's an issue.
Hello?
Transportation is not an eligible expense in this particular grant.
I get it, but I mean, like I was just saying, like, since we were speaking about the affordable housing and everything, it's like the buses stop at a certain time, but okay, let me.
But that being said, with the collaboration and the case management and all, that's one of the pieces that case managers take on for their clients, is making sure that they have access to transportation, that there are arrangements, and making those connections.
I get you.
Mm-hmm.
Thank you, ma'am.
All right, I'm gonna give it another minute, and while everyone, please put your name, organization, contact information in the chat box. And we'll give it one more minute. If anyone has any other comments, concerns, again, thank you for being here. Be looking for the email sometime tomorrow afternoon that we'll have the slides from today. We'll have, and embedded in the slides are the links. I didn't want to have yet another thing where you had an attachment. Embedded in the slides are the links to all of the information on Department of Housing and Urban Development's website. And if you get in there and you start to reading, trust me, there's a link that takes you to a link, and you could be there for hours learning all kinds of, it's really lots of information, but I invite you to take some time to look at that. Also takes you to the city's consolidated plan. You can read a whole 130 something pages of it if you wish. But I wanted us to be able to see that this is real plans, this is real research, this is real planning that's been going on in our community, and we're just trying to piggyback off that, not recreate the wheel, but continue the discussion. About 30 more seconds, and we'll cut it off for the night, and I'll give you guys back a few minutes of your time. While we're doing that, again, thank you everybody for coming, and be looking for the information to everybody. Be looking for the information to come out, and looking for it. We'll send out the information in one email, and then we will send out a Google form just asking you to respond to some priorities and ranking some projects from greatest to lowest need. So with that, we'll call it a night. I appreciate you all for being here, and I look forward to some more vigorous discussion and seeing how we can affect positive change in our community. Y'all have a
Thank you,
great night.
Pat.
Thanks, guys.
Appreciate you.
All right,
Thank you.
bye.
Bye-bye.
Good night.